Let me begin by thanking my dear friend, Dean Ayman El-Mohandes, the founding dean of the CUNY Graduate School of Public Health and Health Policy, and Dr. Scott Ratson, distinguished lecturer, for your availability to talk with us about the importance of COVID-19 vaccinations and about valuable information that the Queens College community ought to be aware of. Like all CUNY colleges, Queens College has actively participated in the Vax Up CUNY program during the past academic year on an ongoing basis. Our president, Frank H. Wu, and leaders of our academic community have consistently and ubiquitously promoted vaccinations in all kinds of ways. Queens College has sponsored pop-up events at our Student Union building for both the campus and the greater community that we serve. Collaborations have been arranged with local hospitals for walk-in vaccinations, and the college has worked very closely with local pharmacies. Lillian and I will alternate using a question and answer format. We would be grateful if we could speak with each of you one at a time. We would welcome and appreciate hearing both of your answers to all the questions. I'll start with the first question. Please give us your best shot on the principal reason why everyone, students, faculty, staff, and alumni should be vaccinated. And let's start with Dean El-Mohandes.
I would say that what we are aiming for domestically, locally, domestically, and globally is elimination of the COVID-19 virus. Attempts at mitigation are simply not going to be enough. There is no way moving forwards, protecting ourselves, our communities, our families, our nations, and the world from another resurgence or an appearance of another mutant of this virus unless we eliminate it completely. We're not going to be able to eliminate that virus unless we stop it in its tracks. It is not only a question of one of us getting sick or, God forbid, suffering consequences of the illness or loss of life. But even if we are exposed to the virus and we are not able to prevent it from entering our bodies and passing through our bodies, even if we remain asymptomatic, then we will not be able to prevent the virus from continuing to produce new mutants and new variants. And as long as it's able to do that, it will continue to jeopardize the safety of our communities and of our nation. All of us have an obligation. All of us have a communal responsibility to eliminate that virus. And there is no other way but stopping it in its tracks. Once the virus encounters a vaccinated individual, it is not able to pass through, modify itself, and become ready to infect others. More importantly, the vaccines that we have now in our country seem to show very strong efficacy against the mutants that we know exist amongst us. We do not have any guarantee that unless we are prepared by being all vaccinated, stopping the virus in its tracks, that we will not ourselves nationally produce the next variant. That is extremely important for us to understand, that our participation is at the highest level, and its significance is tantamount to a personal responsibility to contribute to a global response.
Dr. Ratson?
Vaccines have been around for centuries, and the technology of how a vaccine works began with smallpox that has been eradicated from the planet, and we've nearly eradicated polio from the planet, at least the Western Hemisphere. We don't have polio. So we know that vaccines work. They have been our ways out of past epidemics, and it's really the only thing that we have available in our arsenal to fully get rid of the challenge from COVID-19. As the dean also mentioned, these mutants, or what we call variants, also continue to come into circulation that can only be protected for people who are vaccinated. And if they're not vaccinated, or whilst even waiting for vaccination to kick in some cases, they need to wear a mask and have other protective measures. So no other time in history, that certainly not in my lifetime, has public health been so important, not only on the messages related to people taking the personal protective experiences, if we can call them, let me call them PPEs, whether they're masks, hand washing, social distancing, the personal responsibility to get vaccinated, but also the responsibility, both in an altruistic and necessary way, to be a member of society to protect themselves and others with vaccination. So I think we're really key on this broadly. We can talk also about the need for childhood vaccination. Many of us do not have measles, mumps, rubella, diphtheria, pertussis, tetanus, and others that have been around for some time, because vaccinations have also been successful there. So we shouldn't be questioning the science. We should just figure out ways of getting the science and the vaccines into people, because vaccines and vials don't save lives. Vaccinated people are the ones who will save lives.
One quick follow-up question. You are the leader of a major project called Convince USA. Could you tell us about it?
Well, last year, in the midst of the pandemic, first thing that we started to do at CUNY was look at what the public was thinking. And we started this on March 13th, right at the height of the epidemic in New York City and the unfortunate experiences that people were having of not knowing what to do. We were worried, as you might recall, did we have enough ventilators? Would we have enough ICU beds? There were lots of issues. So we were looking at all of the different aspects and realizing that, just as there were in past pandemics and other environmental challenges, we didn't have really good, clear communication. It wasn't coming from Washington. It wasn't, frankly, coming from all different levels of society. And our surveys showed that the consumers and the public in New York City and all of New York State wanted better information. So we started to host a number of dialogues. And in short, we had a global one at the United Nations during their high-level political forum in July, where we put the idea forward of CONVINCE, which stands for COVID New Vaccines, Information, Communication, and Engagement. And at this discussion that we had with the World Health Organization, the Global Alliance for Vaccines, Gavi, myself from CUNY, the London School of Hygiene and Tropical Medicine's Vaccine Confidence Project, World Health Organization, and others, we launched this call to action that we thought we needed to convince people of the importance of preparing for the vaccine. And at that point, the vaccine were not available. So we developed that. Later in the year, we have had this evolve, where we have actually activities both in the United States, Canada, other parts of the world. And what we've been working on with Convince USA are a whole variety of activities, some at the community level, and many also, such as this level, shall we say, via all different media channels, to give people the best information to make the appropriate decision. And a term that we've come up with, which also has highlighted the importance of Convince, is vaccine literacy. Having people the understanding of what vaccines can do, why they're important to them, why they're important to their community, and also why policymakers, as well as researchers, need to give the kind of support for vaccines to be available with equitable access throughout society. And that's really what we're all about with our efforts with Convince and otherwise.
Some folks have expressed their concern about side effects. Are there side effects of vaccinations that we need to be concerned about, such as allergies, rashes, impact on pregnancy, infertility, and any other ailments that people may have?
Some side effects are just, you got a shot in your arm and it's painful, and that was expected. Now, is pain for 1 day expected, 3 days? Is there a fever that's expected? Some of those are side effects that will go away as they might with other vaccinations, and they're really not an issue. And it doesn't necessarily mean if you don't get the side effect that the vaccine doesn't work. So we just try to prepare people so they know that these side effects exist. I've been asked this question in a number of cases in terms of women of reproductive age, and others in terms of sterility. Is it safe? The American College of Obstetricians and Gynecologists has said that it is safe, and they are recommending it for all people of pregnancy or even of reproductive age, as are other professional institutions, including the Centers for Disease Control, that's looking at the large data sources. So we believe that it is safe in all of that regard. In terms of your question on some specific allergies, if people have been allergic to other vaccines, they do need to raise that with their primary care provider, whether it's a physician or others, before they may help them in terms of a choice of a vaccine, since there are different ones that are available. But that's the kind of advice that we've been giving people. And there are systems in place, because the idea of a side effect is what you mentioned, a headache, a potential fever, a pain, which could be different from an adverse event, which is another potential negative sequelae that could come from a vaccine. But these are very, very rare. And in all the cases that you may read about in the press, they are rarer than if one were infected with COVID, of actually having some of those same symptoms and diseases in these cases.
Pfizer has actually applied to lift any restrictions on the approval to the vaccine. Early on, when these vaccines were produced, and they were produced at astronomical speed, they were approved on emergency basis by the Food and Drug Administration. But now millions of people, literally millions of people, have received the vaccine. Enough numbers where, had there been any unforeseen adverse events, that they would have been observed and documented. And at the present moment, Pfizer has an application that hopefully will be approved soon by the FDA, where there is a clear description and reporting of any adverse events. And based upon that, this restriction will be lifted.
This is a question that has a couple of parts to it, but it's essentially the same fundamental question. What about the need for booster shots? Will everyone getting the vaccine need to get a booster? What's the likely time frame? Will there be a difference for the need of a booster depending upon which vaccine you received, whether you received Pfizer or Moderna or Johnson & Johnson? And of course, we've all read media reports about a study on the potential positive long-term immunity impact of vaccines. So what about the need for booster shots?
For a new vaccine like this one, time is really going to be telling. It's going to be difficult to predict, but the predictors as they stand currently seem to indicate that the immunity, at least the reports that we're hearing from the mRNA vaccines, the Pfizer and the Moderna vaccine, that the immunity is long-standing, longer standing than originally anticipated. And I need to tell you that in many cases, such as, for example, adolescents receiving the measles vaccine after they had been vaccinated during early childhood, was something we found out when we realized that young adults coming into colleges had outbreaks of measles. So we had not known that. And it was many, many years later that the necessity of a booster shot for the MMR at the late adolescence, pre-college age, became an indication. So the idea of predicting when and if a booster is needed can only be discovered with time. There are tests where antibodies are checked, and science even indicates that even when antibody levels in the blood decline, that does not mean that immunity disappears, because there are other elements of the immune system, including what we call the cellular immunity and memory cells of your immune system that keep track of the nature of the virus, may protect us even when the antibody levels have declined. So it is going to be somewhat of a wait and see, but the early indicators show that the immunity is lasting longer than originally anticipated, where people were thinking within 6 months, perhaps, people will need a booster shot, but it doesn't seem to be the case so far.
Dr. Russell?
Indeed, it is positive of what we've seen from the vaccines that have already been given, that there is the immunity. It may not require a booster shot. You know, as you mentioned, Jay, there is this discussion in the media, so people have these hypothetical questions. And the Advisory Committee on Immunization Practices, which is convened at the CDC, did have a discussion on this recently. And they were discussing it, if hypothetically there were a booster shot, could it even be given with other shots? Because we have to remember that we're going to have to take a seasonal flu shot this fall. It's recommended, and it's been a target of the United States for and up until 2030, we want to get 70% of the population vaccinated for seasonal flu. And we have not done that yet in any year yet. So there's already that challenge. And the CDC Advisory Committee, which included members of the American Academy of Pediatrics, the American Academy of Family Physicians, has recommended that if there were a booster shot, that it could be given with seasonal flu. But we're reminding that we need to get in the routine of getting an annual flu shot, as well as these other potential booster shots. It does appear right now that will be unlikely to have one this fall, as the dean mentioned, but there may be a time in the future as we continue to track the different vaccines. And frankly, most of your viewers or listeners here today will have had either the Moderna or Pfizer vaccine. Right now, only 12 million doses of the J&J vaccine have been given in the country. So it's fewer than 5% in the US right now. And we want to make sure that everybody, of course, has equity in terms of which vaccines, but also to be aware that it seems that maybe the minority vaccine, if I can call it that right now, that it's minority in terms of only fewer than 5% have got it. That is the one that there's a lot of more conjecture in terms of a booster shot.
What about the impact of the vaccination program on desperate situations involving underrepresented communities? And we have an example right here in the borough of Queens, where Southeast Queens has a much lower vaccination rate than other parts of the borough. How is that being addressed? It's
an excellent question, and it's unfortunate that we had fireworks that went off, that we reached the 70% threshold. Those were statewide. We don't have that threshold in the city. And if you look at the map of the city right now, it happens to be in shades of blue, but the dark blue is more in Manhattan, and it's a checkerboard when you look at the rest of the city. And as we know, people don't live and work in the same zip code block that's this checkerboard. So we need to do our best to get everyone up to the 70%. Yeah. And that requires different kinds of outreach. People from Queens might not want to go to the Bronx, to Yankee Stadium, or somewhere to the Javits Center or so forth. And we also found that in our CUNY School of Public Health surveys, people didn't want to travel. They wanted to make it easy. They wanted it easier. They wanted it close to where they work or close to where they live. And I think we need to do more of that. And it's not just outreach by bringing a van there. And it's not just saying we're going to do it at a local church. We need to have ongoing basis. And there are some home opportunities now for also people that are unable to travel, but we need to work across the board for better equity. And I know the city, the Department of Health, Mental Hygiene, and others are trying. I personally think we need to also have medical care, whether it's physicians, primary care physicians, clinics, places where people go, what they call their medical home, should also be able to give the vaccine. And they all haven't been able to, because initially there wasn't enough of it, or it needed to be kept in cold storage and so forth. So that will evolve, and hopefully we'll get to the 70%, but we need to not give up on getting to the 70%.
Yeah, and very importantly, we also need not to blame the victim. Early on in Harlem, we did a very good survey when the vaccine was available to people at the age of 65 and above. And we looked within the residents of Harlem if there were any differences based on ethnicity or race. And the rates were exactly the same, whether they were white, Latinx, or African-American, or otherwise. And the differences were in Harlem itself between different parts of the neighborhood, where East Harlem and Central Harlem showed differences between these two locations based on the availability of medical facilities that were giving the vaccine. So in essence, people were open to getting vaccinated, understood the importance of it. And at the end of the day, it was a question of equity of distribution and facility of reaching a place where the vaccine was available. And when we asked people, where I'm referring again to the national poll that Scott is just referred to, when we did a national poll in the 4 largest metro areas and a comparative sample of the entire country, we found that people wanted to go to places where they trusted people they knew were able to give them a vaccination reliably and safely. Many people said, I would like to get the vaccine at my local pharmacy. Many said, I would like to get the vaccine at my local primary care physician. And unfortunately, up to the present moment, primary care physicians are not administering the vaccine. Hospital-based clinics, perhaps, because hospitals are administering the vaccine, and that could be a good, if close by, public hospitals exist. But also, I think people are beginning to go to pharmacies, local pharmacies, and we should encourage them to do that. In my local pharmacy, where I live in downtown Manhattan, I am seeing more and more people come make appointments and come get vaccinated. And I hope we should encourage them to do that. And obviously, the question of accessibility, facility is very, very important. And as we all have other priorities in our lives, we're caring for other family members, we have a job, we have other household priorities. So access is becoming really an important factor. And as life normalization begins, the set of responsibilities, being in transit, being in, on public transport and so on, people are having less disposable time to dedicate to something like getting vaccinated. So being available, practical, and accessible is going to become more and more of an important factor.
What about the concern that some people have that there was rushed approval by the Food and Drug Administration prior to a full assessment of the vaccine effects? Is this anything we need to be concerned with?
Well, I mean, that goes back to the fact that, if you are an early skeptic, time has now proven that there are no unforeseen side effects. There are literally tens of millions of people that have received these vaccines, tens of millions, if not more. And under normal circumstances, by now, that would have been more than adequate for these pharmaceutical companies to submit for a regular approval. So if you were very persnickety about it within a week or two or a month or 6, there is no reason for you to continue to be skeptical. There have been enough people that have been vaccinated to satisfy the requirement of safety under normal circumstances.
It's clear that the hundreds of millions of doses in the United States have been safe and they've been effective, and we're seeing lowering of the disease burden everywhere where you have vaccine penetration. The question in terms of was it rushed? Unfortunately, the Trump administration called it Operation Warp Speed. We know that, at least in our time, we can't travel at warp speed, so it seemed like it was science fiction, and that helped plant a seed in some people's minds. But it did go through the same rigor of clinical trials, which are called phase 1, phase 2, phase 3, that the FDA runs. Those became lexicon of the media to talk about as well. But now we're into what would be the phase 4, or where the millions of doses, what they even sometimes call post-marketing surveillance. And it's clear that we don't have negative side effects nor adverse events that should give anybody concern. We have seen in some surveys, and others call them the wait and see group or the wait and learn group. Hopefully early on they would wait and see till they knew someone who got the vaccine and saw how they were. We also learned that some of the wait and learn, some people were wanting to wait and to find out maybe how much they could get off from a day of work, if they could get some financial incentive. So there were some other reasons, but the actual safety and efficacy and the trials, people should feel very confident about.
Let's go back just a little bit to the availability of the vaccine, just to dig a little deeper into that. How available is the vaccine today? What are some of the ways that people can easily get vaccinated quickly, safely, and without cost?
First of all, the vaccine is supposed to be free for everyone. There have been anecdotes, and there have been actual stories, right, where people have been charged for a primary care physician visit, which they didn't want. They went in to get the vaccine, but that has happened in some places. I believe in New York, as the dean mentioned, and others, there are enough pharmacies, chain pharmacies, local pharmacies, and others who are giving vaccines, and they are available. Yes, you have to have an ID card or who you are, also so you can register, so you could get an Excelsior pass or other things if you're interested in that. But ask for an insurance card, but it doesn't cost you anything. And I think that's what needs to be clear. And maybe if, before students are coming on the campus, I know there are some CUNY sites that also are giving vaccines. Those seem to be available. It's much easier to book appointments down than it has been. So I think the availability is certainly there in New York City. I can't speak the same for the rest of the country, but we should all do everything we can to get some people to our site.
I do believe that the initial rush is over. It is easy to make an appointment to get a vaccine, and there are many walk-in sites around the city where you can walk in and get vaccinated. I was observing that at my local CVS pharmacy. Several people walked in, they walked up to the counter. The pharmacist asked them to wait. The wait period was not long. They had a simple form to fill, and they were vaccinated. I observed it just because I was curious to see how long it was going to take. And the whole process from beginning to end was about a 30-minute process.
It has been reported that approximately 1/4 of the new cases of COVID-19 in New York State are attributable to the Delta mutation variation. What do we need to know about Delta, and how effective are the current vaccines in combating this mutation?
There seems to be indication that both the mRNA vaccines, the Moderna and the Pfizer, have been successful and are effective against the Delta variant. But that's, if anything, we are learning about the Delta variant is that the virus is very tricky. And the only way to stop the next Greek letter mutation is for all of us to get vaccinated, all right? So the Delta variant means one thing. It means that the longer we allow the virus to lurk amongst us, the more likely it's going to try to trick us. The more likely we're going to get a new mutant that could either be more easily transmissible or more dangerous. And the only way to stop it is by all of us getting vaccinated. Even if we are asymptomatic, I know I'm repeating myself, but I'm emphasizing, even if we're exposed to the virus and we are asymptomatic, that does not prevent the virus from mutating in our bodies and us transmitting a new mutant. So the only way to stop the virus in its tracks, Delta, Gamma, or Epsilon, is for us to get vaccinated.
There's even a Delta Plus variant there before perhaps they say Epsilon that's going around, and it has been a cause of concern in Israel's been slowing down their reopening, UK and others, and the conglomerate public health group is really trying to monitor this. But the only way, as the dean has said, is to get vaccinated. And remind people also that if you have been infected and you think you have antibodies, that may not protect you as much as getting a vaccine, particularly against the variants. And the evidence seems to show that throughout this country at this juncture. So everybody who's listening and everybody who knows people who are not vaccinated, now is the time to get this done and not to wait any longer.
It's summertime. People have been in quarantine for months. Travel restrictions are starting to be lifted. Is it safe to travel to states that have lower vaccination rates as compared to New York?
I mean, if you're vaccinated, you should feel confident. So I think that's the big answer, that you should be vaccinated. And the people you hopefully interact with, you remind them 2 weeks in advance if you're going to go there that they also should be vaccinated and have the kind of protection. That's the short answer. Also, of course, if they are not vaccinated, they should have masking for all indoor events, whether they're with 1 or 100 people.
Where are we on tracking? Is there a more sophisticated tracking system in place these days?
I think as the number of cases are decreasing and the number of positives are decreasing with the virus, our ability to track is probably going to be maximized. I mean, there was a moment where there were so many positives that it was difficult to track people. But in the current situation, more and more people are getting vaccinated. And as Scott said, 70% of New York State residents are currently vaccinated. So we hope that we won't need to track much longer, but as the number of positives are decreasing significantly, tracking is becoming easier because the system is not burdened. But without testing, we won't be able to track, and we need to test those that are not vaccinated. And this in itself is in the long run a burden on the system to continue to test and track. And it's really, people want to recycle plastic bottles, because they think it's a burden on the planet, but this is also a burden on systems, and it sucks up resources in ways that we don't need to at this moment when the vaccine is available. And so even if you're cost conscious, if you think of sustainability, go get the vaccine so that we don't have to continue to test and track, please. There is a solution here, and you are part of that solution.
And I agree. And even Lillian, with your question at the state level, people who are traveling have to get tracked and traced, even if they're already vaccinated, because we don't have the policies that are up to speed with where we are with vaccination right now, at least internationally. And even some countries are not allowing US and vice versa. Some of those are appropriate, but if we get the vaccination rate up, and then we have the natural infection rate going down and less virus circulating as well as variants, we all should feel confident in that. The second piece also with tracking is it's appropriate amongst some of these sports figures that are not getting vaccinated. And it's frankly unconscionable that some of them have been able to play in playoff games or others without being vaccinated, or not play because. So I think all of those kind of pieces that are there in some organizations should also give us at least some solace that we are making sure that people do get vaccinated if they are saying that they are, and also trying to protect those who are not vaccinated at this juncture from being exposed. So there is an appropriate level, but it is a waste of resources in some ways, as the dean has said.
What's the likelihood of there being a COVID-20?
I think surveillance needs to be more heightened, early identification, and keeping an open mind about case definition. I mean, there are many technical epidemiological things that we have learned from the COVID-19 that could have perhaps heightened the level of awareness. And I think this has been a very difficult pill to swallow, but we have learned that what epidemiologists and infectious disease specialists have warned against, that policymakers chose to either ignore or express skepticism about, is now more serious and very evidence-based, that I think people need to take it more seriously in the future. The only way to prevent another pandemic from occurring is not going to be able to change the course of the natural evolution of viruses, but it's going to be in taking early detection more seriously and containment more seriously, communication across borders more seriously, travel restrictions more seriously, and for people to respond. It took a long time for people to believe, and I myself have recordings where I said, you don't need to wear a mask, but that's where science was at that moment. Now the level of vigilance is such that we know that we need to take these very seriously, and if we err on the side of over protection, we are probably doing the right thing, because no one could have imagined, except perhaps some scientists' warnings that were considered mad scientist schemes. Now we know they weren't so mad, and we know that it is possible that the entire world population can be stopped in its tracks in such an incredibly virulent manner. And so we know now to be more careful, I believe. I think that will be part of the protection. And I think that global communication hopefully will be better. Maybe the WHO will be more aggressive. Many, many things have changed because of the suffering that the world economy has seen, the world population has seen, the decimation of life that we have seen. I think that the next go around, there will be something in recent history perhaps to inform us.
the SARS virus and coronaviruses have been around for some time, and we've been tracking them with Middle East respiratory syndrome and others that have been generally confined to certain countries. And frankly, they might have been more deadly, which is why they weren't able to travel as quickly, but that's a whole nother discussion. We won't have COVID-20 because we're already 2021. It was named 19, it was first named in December 2019. But there will be other viruses, and there likely will be other pandemics in our lifetime. Hopefully it could be stopped at an epidemic level before it spans the globe if we have the right global health regulations in place, or the regulations that we have in place if we actually follow them, if we have better communication and integration from the World Health Organization to the CDC to national authorities, as well as thinking about how people travel, that we are able to put protective measures in place quickly if we do need sort of to ring off, for lack of a better term, places that may have an outbreak so they don't travel around the world. All those pieces have to come into play. And I'm hopeful. I had written something 6 years ago. They say we're prepared for the next pandemic. And I said, they say we're not, because they kept chopping away at the public health infrastructure. And, you know, I was amongst many other people who've been writing about that. We need to rebuild the public health infrastructure, and that doesn't happen overnight as well. And we have to rebuild confidence of the American public in health and science and medicine. So we also, when we have a proclamation that will come out with some certainty, or even if there's some uncertainty that we don't know enough yet, people will be willing to listen to the experts and not listen to a politician that's going to say, drink bleach or something of that nature.
You know, when I was a kid, the superheroes were in Marvel Comics and DC. On a very positive note, clearly there have been some real superheroes in this pandemic. And I was wondering if each of you might tell us about your experience working with frontline workers, first responders, the health professionals who really have risen to the occasion during the pandemic.
I'm going to answer this with something I'm very proud of. Our students at CUNY School of Public Health and others have engaged in what we call Big Shots Heroes, and it's bigshotsheroes.org, which actually has highlighted people throughout the United States, a number of people that they're ordinary people doing extraordinary acts, what we call Big Shots Heroes, much like superheroes. And these were not health people. These were not the nurse who just said, I'm going to work 3 shifts. These are people that said, I want to help create a Facebook page. I think the woman is based in Queens, actually, that helps people organize their lives in a speedier way to get to a vaccination clinic or to find a space. And it went from 1 to thousands, not tens of thousands of people now that she's been able to help. A group of young people in a different part of the country that figured out a way that by putting T-shirts and borrowing cars or figuring out public transportation systems, helping older and other people get to vaccination sites. Just a unique group of people that have worked in their communities. And I would say these are the heroes. Not that people in the health sector are not important, and many of us have tried to dedicate our lives to better health and healthcare and health services and health delivery, but health is our common currency, and all of us have that where we live, with our communities. And if we can promote that health and well-being, that's what we're all about. And I think that's part of our mission, both at CUNY School of Public Health, at CUNY in general, right? The equity, social justice, the access that we hope to give with health. And bigshotsheroes.org will give an opportunity. And also, we've identified, we conglomerate number of students and others have identified them. But we ask people to nominate their own hero, and hopefully that will be able to catch on. And it's a social media campaign that we feel will be important for people to also be rewarded for acts that they've done that they were just doing out of their own heart. And as the dean mentioned earlier, altruism is key here, and there are probably people that all of us know that could be a hero, and hopefully we'll engage with Big Shots Heroes.
Yeah, I would like to mention the CUNY students in particular, who all participated in the Resource Navigator program. The Resource Navigator program was a program where people who were identified as being COVID patients were contacted to find out what other needs they may need or other family members may need to support them during that period, be they food services or transportation or any other services. And the students at CUNY were recruited to participate in this project, the Resource Navigator, where tens of thousands of COVID positive cases were screened and were supported. And if we're going to talk about heroes, from the moment I arrived at CUNY in 2013, I have encountered so many heroes in the students of this university who have, despite all obstacles, prevailed, who have demonstrated the highest level of participation and altruism, insight, community awareness, and team play. So they should be mentioned amongst our heroes as well.
Thank you. We've covered a tremendous amount of information in this joint interview with both of you. I'd like to close by asking each of you if you could sum up in one sentence, why it is important to be vaccinated.
Stand for what is right. Get vaccinated.
You need to protect yourself, your families, your communities, people you love, and your life. Get vaccinated.
Thank you both very, very much. Deeply, deeply appreciated. And we will spread the word about each of the programs that you cited at the end of the interview. We'll do our best to do that. And I want to thank you both very, very much for this outstanding interview.
I just want to say that the CUNY Graduate School of Public Health and Health Policy is a university-wide graduate school. We serve all campuses. It is our mission and it is our duty. Please visit our website, and under COVID-19, you will find a lot of information. We are here to serve you, and we are here to answer your questions. We are proud of it. We are humbled by the role that we are allowed to play. Thank you for inviting us.